Welcome to another edition of Getting to Know Your Board, Conversations with the President. My name is Jim Fang. I'm the current president of HFSA, and I'd like to welcome Orly Vardeny to our series, a longstanding member of the Society and current board member. Welcome, Orly.
Thank you.
Thank you so much again for doing this.
This is great. I'm glad to be here.
Yeah. Well, I want to open it up with you telling us a little bit about yourself professionally. Where did it all start? How do you spend your days, weeks, or months?
Great. So professionally, I started where you currently are, um, at the University of Utah. So this is where I went to pharmacy school. So I'm a pharmacist by training, and I went to pharmacy school and got my PharmD at the University of Utah. And then I stayed on in Utah for all of my post PharmD training. I did ambulatory care, clinical pharmacy residency, so pharmacy PGY2, PGY1/2. And then I stayed on to do research because I was interested in cardiovascular research in particular. So I stayed on for 3 years doing heart failure and other cardiology based research, mainly in clinical trials. And then my first position out of training was at the University of Wisconsin School of Pharmacy. And I was there for a long time, over a decade, where I was a professor and I was teaching pharmacy students in the PharmD program, doctor of pharmacy program, and starting my research program, which started as translational and with a pretty heavy lab component to my research. But as I continued my trajectory, and while there, I started transitioning to more clinical research because that became more of a passion for me. And from the get go, I started with heart failure, and I've been doing that ever since. About 7 years ago, I moved from University of Wisconsin to in Madison, Wisconsin to Minneapolis, which is where I am now. And my position changed. So I don't work, I have an appointment at the university, but I that's not my employer. I work at the Minneapolis VA, and I'm a core investigator in their COIN program, which is Center of Innovation for Health Services Research. And so it's called the Center for Care Delivery and Outcomes Research. And I'm also a professor at the University of Minnesota Medical School. And
That's
so
fantastic.
my day is a mix. I do some clinical practice at the VA, taking care of patients with heart failure. So it's an outpatient clinic. I do 1 day a week. And then the rest is research and mainly clinical trials or other clinical research.
That's fantastic. I didn't know that. I didn't know all that about you. I knew you had started here at my current institution, but that's a fantastic journey. Well, Orly, why heart failure? You've done a lot of things, right? You have been a clinical pharmacist. You have taught. You've done basic investigation, clinical investigation. But why the heart failure discipline specifically?
I think I was interested in heart failure for I've been interested in heart failure for a long time, 20 years, and that what drew me to it was the complexity. And 20 years ago, we didn't have as much as we have now in terms of great treatment. We were learning the learning trajectory was steep, but I thought there was a lot left to learn. And I thought it was a great place for a pharmacist to practice because a lot of what we do in heart failure is treat with medications. So I thought it would be a good place for me to try to contribute.
Yeah, no, that resonates with me and many of the other members of the board too. The complexity of the condition and what we can do for patients that are not procedure based, I think is very compelling as well. Well, why the Heart Failure Society? I mean, you get called by the ACC, the AHA, pharmacy societies, pharmacology societies, institutional societies. I mean, what is it about the Heart Failure Society? Why have you been a member so long, and why do you spend so much of your time volunteering for us?
I started off with professional societies in the within pharmacy professional societies and started branching out a little bit as some pharmacist leaders became more involved with the Heart Failure Society of America. And those individuals started pulling in more pharmacists to become engaged in HFSA. The HFSA became very quickly became my clinical home, and part of it is the multidisciplinary nature of it, and the just frankly the attitude that it takes a village, and every member of that village is valued and brings something different to the table. And it's sort of that framework that really resonated with me, and the fact that it's not HFSA is not overwhelmingly large so that you can't get to know people. I thought it was very everyone was very accessible, and in that sort of small knit setting, you can really meet, connect, identify collaborators, learn from other people, help mentor other people. And so I think it's just a perfect size to be able to thrive as a young mid-career and even a more seasoned practitioner.
Yeah, that resonates with me as well, and it's been a familiar theme. People have pointed out the size is perfect. It's not too big, it's not too small. Two, we're all brought together by our passion to reduce the burden of heart failure. And then three, it's very intimately team-based. It doesn't matter whether you're a cardiologist, internist, pharmacist, PA, nurse practitioner, nurse. Um, what we view as the collective mission, not not the name tag. Well, let's talk a little bit about you. How do you like to spend your time when you're not working?
When I'm not working, I love spending time with my family. I'm married. I have 3 kids. Um, my son is the oldest, and then I have 2 daughters. We are all O names. So I'm Orly, my husband Oliver, and then my 3 kids are all O names.
Oh
And
my
they are
gosh.
15, 14, and almost 13. So we enjoy uh, being outdoors, and we have a cabin in the North Shore that we enjoy visiting and rock picking and hiking. And I'm the only skier in my family, but everybody else in my family snowboards. So we enjoy going to resorts and snowboarding and skiing and traveling. An avid runner, although I think my marathoning days are over, but I still really enjoyed running.
Hopefully your knees and ankles and hips have held up.
Yeah, that's part of the issue. Remaining injury free is tougher as you get older.
Yeah, it's definitely traumatic on the joints. If you don't mind me asking, you said all of your kids have O names. Do you mind telling me what they are?
Oh no, I guess I forgot to mention that. So my son Olin, my middle daughter Olive, and my
Uh,
youngest daughter Opal.
oh, those are fantastic. Beautiful names. That is really great. So everybody's OV.
Everybody's OVN. So my husband's last name is Ni, and I Um,
Oh my gosh.
so
You have to be careful with writing your initials, huh?
yes,
It can,
definitely.
it can refer to a lot of folks in the family. Well, as we had talked about earlier, I was going to ask you, what is your favorite movie? I mean, do you like movies, and do you have a favorite of all time or something more recently that was compelling?
Yes, I do love movies, and as a family, we enjoy movies, a lot of movies, together. And this was especially solidified during the pandemic. But I have to say that my favorite movies are a little bit dated. The first one that comes to mind is The Shawshank Redemption, um, just because of the overcoming adversity and just that the story. If I had to pick a close second, it would be Goodwill Hunting.
Ah, two great movies.
And then a third might be Stand By Me.
Another great movie. You did speak to why Shawshank Redemption speaks to you. What was it about Goodwill Hunting that you loved?
I think it was what drew me as someone that was discovering himself, discovering, dealing with and overcoming internal conflict
Yeah.
and healing from it is uh, something that resonated with me.
Yeah, no, isn't it great how the greatest movies are all about the people and their relationships?
Absolutely.
I think I told you that my favorite movie of all time is The Godfather, and because the characters, the family dynamic, the relationships with others, notwithstanding, of course, the stories of mafia and violence, which some people might could do without, but it's just a great,
No, I think it is about really. I mean, that movie also is about relationships.
uh, and family, and family. So.
Exactly.
Well, Orly, thank you so much for taking the time to speak with me. It's been really a pleasure to get to know you better, and hopefully this will resonate with our membership. So thank you again.
Thank you, Jim. Pleasure.